Good morning, one and all. Dr. Steve Zahm here with another exciting episode of Tooth Teacher Tuesday. Today I want to talk a little bit in kind of our mainline series of videos. I want to circle back to something that I touched on a little bit a while back. We had a really well-received video talking about the order you should brush and floss and use mouthwash. The reason for that being to avoid rinsing all the good fluoride off your teeth from your toothpaste with the lesser fluoride that's found in a lot of your dental mouthwashes. So I kind of want to circle back over the next couple weeks and talk a little bit more about fluoride because it's a very important instrument in our tool belt as dentists, but it's also something that in the public eye has been kind of controversial over the years. So yeah, the next couple weeks we'll be talking about fluoride. Today I kind of want to focus in on the different forms that fluoride comes in, different ways that we're exposed to it. So as we talked about a while back, your basic form of fluoride exposure is going to be in your toothpaste. Most toothpastes, as far as the major brands, will have fluoride in it. Some of the more off-brand ones that are more focused on holistic or organic or natural, that kind of niche of healthcare, sometimes don't have fluoride in it. But kind of starting with that baseline of what's found in your toothpaste, as we mentioned before, most dental mouthwashes by comparison either have no fluoride in them, or if they do have fluoride in them, it's about 1/5 of what you'll find in your regular toothpaste. So that's to say your average toothpaste is going to have 1,000 parts per million of fluoride. That's kind of the number we use, or the unit of measurement we use in dentistry to measure the amount of fluoride. But so most toothpaste is going to have 1,000 parts per million. Mouthwashes, if they do have fluoride, are going to be about 200 parts per million. And by comparison to that, some of the stronger ways to expose yourself to fluoride, kind of the step above your regular toothpaste, would be a prescription fluoride toothpaste, something that the amount of fluoride is so high you can't just get it over the counter. You actually need a prescription from your dentist. The most common brand name one would be Prevident, and it's called Prevident 5000 because the parts per million is 5,000. So Prevident is going to have 5 times as much fluoride as your normal toothpaste. But Prevident is great. That high fluoride, I recommend it to every patient just because it's a low enough dose of fluoride that it's not going to have any adverse effects, but at the same time it's strong enough to really help fight cavities, especially in patients that are cavity prone. I really advise using the Prevident or some other kind of prescription toothpaste. And then kind of the ultimate step above that, it would be having an in-office fluoride treatment. Most offices, my office for example, we do a fluoride varnish, which is kind of the sticky, I don't know what to compare it to, kind of a sticky paste that's painted on your teeth at the end of your cleaning. It is a very high amount of fluoride, which is why you can only have it done in office, because you need a professional to apply it so you don't run the risk of ingesting too much fluoride. But that is about 5 times as much as what you'll get in Prevident. So it's close to 25,000 parts per million fluoride, which again is still not toxic, but high enough that you'd want a professional applying it. But again, in-office fluoride, I recommend it to all my patients. Doesn't mean everybody uses it, but it is considered the standard of care by the American Dental Association to get as much fluoride exposure as possible, including an in-office fluoride treatment at all of your cleanings. So those are different types of fluoride treatment. There's also, we won't go down this rabbit hole, but many years it's been a topic of controversy of fluoride in the water supply, and it's something that most most cities regulate their fluoride levels to be within a certain range. Most water naturally doesn't have enough fluoride in it, so fluoride gets added to a lot of drinking water. But some places naturally have a higher concentration of fluoride in their water, and so some water treatment plants actually have to remove some fluoride from water. So fluoride is naturally occurring in the water supply as well, although not nearly as high a concentration as some of the treatments we've talked about. And there's even fluoride in other sources as well. And first thing that comes to mind is a lot of your sodas, pops, cokes, whatever you call it, whatever region you're from. I know different names, but your different pops have a certain amount of fluoride in it that helps contribute to the carbonation. So not that I'm saying you should drink pop and think it's going to prevent cavities, because that's the opposite of message I'm trying to make, but there are other ways you're exposed to fluoride as well. So that's kind of it for today. Next time we'll continue talking a bit more about fluoride, and we'll kind of talk a bit more about the controversy surrounding it, about, you know, is fluoride toxic, and we'll kind of continue from there. But for the time being, thank you for listening today, and hope you have a great week. Thanks for watching, guys.